Welcome, and thank you for your interest in learning more about the Conversation Project and our resources. I'm Patty Webster, and I'll be your guide to introduce you to our work and help you navigate our website so you can get oriented to and take advantage of all the free resources we have for you to use in your personal or social circles, your work settings, or wider community to help jumpstart conversations. This video is geared towards those who want to spread the work across your community. So let's get started. Here's a roadmap of what I'll cover today. I'll start with a quick overview of the Conversation Project, our mission and how we work. I'll then walk you through an orientation to the various types of resources and tools we have on our website. My hope is that you will walk away with a better sense of what we have, where to find it, and how to make the most of all we have for you. There's no sense reinventing the wheel, so the better acquainted you are with our website, the better you'll be at navigating our tools to get you started. And you can avoid creating something from scratch that we or others may have already made available for you to use, adapt, and adjust to your needs. Our motto is steal shamelessly, share widely. Next, I'll share some of the most common questions we receive and where to find the answers to those questions. And lastly, I'll share several ways you can engage with and learn from the hundreds, if not thousands, of community members who are spreading this work across their communities. So who are we? The Conversation Project, an initiative within the Institute for Healthcare Improvement, is a national public engagement campaign dedicated to ensuring that everyone's wishes for care through the end of life are understood and respected. We encourage conversations early and often before a medical crisis happens in the comfort of your own home. We do this by raising awareness, providing free, easy-to-use guides on our website, and connecting with people where they live, work, pray, and learn. So why does talking matter? Discussing our values and wishes can bring us closer to people. And talking with important people in our lives and our healthcare team creates that foundation of a care plan built on what's important to us that will be available when the need arises. We here at the Conversation Project have no preference on the type of care people want or don't want, as long as they are talking to those that matter about those preferences. Equally important is that second part of a conversation, which tends to be forgotten: listening. Embrace being quiet, turning off our inclination to react, respond, or problem solve, which brings in our own biases, is critically important. We encourage folks to acknowledge what someone in front of them is saying by leaning into their thoughts, feelings, and listening to what matters to them. We love this quote from Dr. Atul Gawande, as the ultimate goal of our work really is the same: to ensure everyone has a good life to the very end. We believe that together we can transform how we live through the end of our lives, one conversation at a time. We know not everyone is given equal opportunity for a good life. We've seen the inequities and the racial disparities that COVID laid bare, that have been with us way before COVID. Not everyone has the luxury or privilege to think about a good death when they are struggling to live life, put food on the table, worrying about finances and cost of treatment, and simply living in peace, not just dying in peace. Part of our work is to ensure everyone is reached, listened to, and respected. We don't want to create further inequities of care at the end of life. So let's dive in a little more into the three pillars of work that we focus on here at the Conversation Project. First, we raise awareness of the importance of these conversations early and often through traditional and social media channels. We invite you to follow us, like and share our content that we share in tweets, posts, etc. The content we share includes articles of interest or blogs, our free tools, and stories from others who are initiating these conversations with their families or in their communities or those that matter to them. Next, we share information and resources through our newsletters, one geared for the general public and another geared toward those community groups or individuals like you working to spread this work, not just to those in their personal or social circles, but who are looking to reach more people in their community. Our newsletters share relevant content and tools that can help you spread this to others. Lastly, we do some limited speaking engagements to help train folks on how to facilitate these conversations. And at times, we talk to the general public on the importance of having conversations about care wishes. From Sheboygan to Portland, Orlando to LA, we've talked to groups in healthcare, community, and faith settings. We share ideas and tools with large employers seeking to support their employees who may need to have these conversations themselves, or with those they care for, such as NASA, Fidelity, Goodyear, and many others. And we've shared our resources at large conferences, virtual or in person, including the National Funeral Care Alliance, the Annual Assembly of Hospice and Palliative Care Medicine, and more. Next, we provide free, easy-to-use guides and other resources on our website to help jumpstart these conversations. We'll dive into these resources in just a minute. The third area of our work is all about supporting community groups across the globe, not just in the US, to help them connect with their community members where they live, work, pray, and learn, to support conversations. This map here is one from our free monthly community webinars, where we asked folks to identify on the map where they were calling in from. Most of our community champions, as we call them since they are championing this cause locally, are located in the US, as shown here. But there are many other wonderful organizations outside the US, in Canada, New Zealand, Argentina, Norway, the UK, India, Brazil, and more, doing fantastic things to help their communities jumpstart care planning conversations. So here we have a list of the various types of groups that are using our resources and spreading the importance of care planning conversations. This includes folks in healthcare settings, from primary care to specialty care to those in hospice care. Individuals such as retirees taking this on as an encore career, or death doulas, community volunteers. We also see faith communities, financial or legal advisors, local nonprofit organizations such as Areas on Aging or senior centers. Many individuals and groups from these sectors join our calls, connect with us through social media, email or phone calls, and share what they are learning with us and each other. It's this learning and the stories and data that they share with us that inform the content we produce and resources and tools that we make available widely to all that I'll walk you through next. So I hope this gives you a solid idea of who we are and what we're all about. You'll learn more as we dive deeper into our resources, and I'll point you to where you can find more in-depth knowledge on various topics. So who can benefit from our resources? That's easy, everyone. Whether you're looking for a resource to help you think about your own care wishes or the wishes of someone you care about, or you've already done those steps and you're seeking more information on how to help others jumpstart conversations, we've got something for you. It's just a matter of finding it. So let's walk through some of our key resources and provide you with a roadmap on where to find what. The best way to learn is really to make sure first you've had these conversations yourself with those you care about, and then take some time after this orientation to explore our website. Over the next several slides, I'll be showing you screenshots of our homepage on our website and where to find what. This table at the top of the page lists what you might be looking for on the left-hand column. The middle column tells you where to go on our website, and the right-hand column shows you what you can check out on that particular page of our website. Below the table is a screenshot of our homepage. We have several tabs you can click on. I drew red circles around the tab I'll be directing you to click on to find out more information. So for example, the very first stop, for some of you, may be our About Us tab, which is circled here, where you can find more on the origins of our work. Our story, our staff, and more background can be found on this page. Many people are eager to get more involved and want to bring these resources to their community at large. We offer up some general guidance here on our About Us page. The next and most frequently viewed page on our website is our Get Started page. Click on this Get Started tab, circled here, to access all of our conversation starter guides and other related resources to those guides. All of our resources, including these, our flagship conversation starter guides, are free to print at home. The guides are designed to help get folks started by thinking about what matters to them when it comes to care, and then making a plan to share those wishes with those important to them. You can also purchase large quantities of these guides, make edits, or add your logo. All of that guidance can be found on this page. As a note, these updated guides were refreshed and released in 2021 after months of research to ensure they are appropriate and approachable for larger and more diverse audiences than we'd been originally reaching. And many of the guides are available in multiple languages. We welcome any new language translations and encourage anyone to let us know if they're willing to translate these for use by others. We also have personal workbooks for anyone who has been diagnosed with a serious illness and a 2-page guide for all of us on being prepared in the time of COVID-19. Both were created with Ariadne Labs. In addition to our guides, we have a whole host of videos to help jumpstart conversations. These can be found by clicking on our Videos tab circled here. This first video provides an engaging introduction to the Conversation Project. In it, Diane Sawyer shares how Ellen Goodman started TCP and shares the story and experience of the Jennings family. The father and the daughter talked about everything, except what matters most to each of them through the end of their life. It shows the family having a conversation together. Next up, we have a couple humorous short videos to help make this topic more lighthearted and accessible so it's not all gloom and doom. This and other videos help ease the gravity in a fun and meaningful way. We've gotten a lot of really good feedback on these videos. We also have a really heartwarming video of a mom reading a letter she wrote to her family, sharing her wishes. And one last sample is this short, heartwarming video, A Soul Doctor and Jazz Singer, especially poignant for those in healthcare. All of these videos are free for you to use in presentations, workshops, and what have you. Here, the best place to dig in on our website if you want to learn more specific ways you can bring this to your personal, social, or work circles and across to your community is to check out our Get Involved tab. We'll spend most of our time here today digging into the resources you can start with. If you're interested in reaching those within a healthcare setting, I'd start with this healthcare resource page. Click on this circled box, and it will take you to a ton of resources geared for supporting those in the healthcare settings. Again, this is on our main Get Involved page. When you click on the Healthcare Resource tab, here is a list of some of the headers and specific resources we have on this page. For example, we have an online course, a white paper, and a toolkit for clinicians on how to engage patients and families about care wishes through the end of life. We also link to some wonderful resources that others have put together on cultural and ethnic considerations for care and conversations. The last bullet there is worth noting. Several research studies have been conducted by others, and so we list a sampling here that you can check out on that page. Next up, if you're looking to engage or are part of a faith community, the Faith Resources box here is well worth clicking on and checking out. So go again to our Get Involved page and click on Faith Resources. We have loads of content in these categories here on this resource page. Our Getting Started Guide for Congregations is a great place to start. It's filled with examples of how diverse faith communities are encouraging their congregants to engage in thoughtful reflection and have conversations about their healthcare wishes. We also share sample sermons that can be used to preach to congregations, programs that can be used to run a workshop or an event, and a webinar series that walks you through the Getting Started Guide. There's also a couple case studies here. A lot of great learning from many others on this page. The third and most heavily visited page on our Get Involved tab is our Community Resource page, found by clicking on the far right-hand side Community Resource box here. We organize this page in sequential order to make it easier to navigate for you. But you can jump around and find whatever resources suit you, depending on where you are in your journey. We suggest you start with the resources under Get Started, and one of the first resources you'll come to is our Getting Started Guide for Communities. I'll go into that further in a minute. In this section, we have links to numerous short case studies, and we point you to recorded webinars that share loads of examples from others who are doing this in their community. We share how to align with the Conversation Project's resources and mission through branding guidelines and link to our principles on how we work with community partners. We also share some templates and ways you can keep track of your own efforts. The next section here is for those wanting to host an event or workshop, either in person or virtually. There's a link to this blog pictured here, 6 steps for introducing the Conversation Project to your community, which I highly recommend as it lays out some clear steps with corresponding ready-made resources you can use and adapt to whatever your needs may be, all free. Some of those resources include a speaker's training to give you more confidence on presenting this to others, a slide deck you can use to run a program, a guide to help share our tips and tricks for facilitating and teaching, sample meeting agendas, press releases, and more. The last section here gives you ideas and tools to help you promote your message. It provides links to several blogs we've written and other resources that we recommend to help reach and motivate individuals to take action, how to engage various types of audiences, and a list of tried and tested conversation starter phrases that have worked really well for others. So here, I noted this guide earlier, and I just want to give you a quick peek into its contents. We've updated this Getting Started Guide for Communities in 2021, and start this guide by sharing lessons on how to approach this work, whether you're seeking to share this with 5 people or 500. Inside, the guide is broken into 4 steps to help you think about your approach, plan your strategy, take action, and then directs you to further resources to keep you going. We share 10 questions to think about to get you started, provide a lot of examples from others, and gives you space to pause and fill in your own thoughts as you go. We have a recorded video like this one that you can watch that goes more in depth into this guide and the 10 questions. This Community 101 recording is on our community call connection page. I'll show you where that is in just a couple minutes. It's worth flipping through this guide to see if anything jumps out and may be helpful. There's no one way to do this, but this gives you some thought and hopefully some good food for thought. Another guide I just noted is our tips for facilitating and teaching about the Conversation Project. Whether you're looking to host a virtual or in-person event, this guide pools everything we've learned from our own experiences and from the experiences of hundreds of community champions across the US and beyond. We share the top 10 things to think about when hosting an event, stories we use and how we use them when we speak. We address common discussion questions that come up at events and share some additional resources you might be interested in. And based on the latest messaging research, why we include language and terminology, the messenger and the message you all convey, why that all really matters. And the last thing I want to point you to specifically under the Get Started section on our community resource page are the short case studies I noted. The groups highlighted here are spread out across the country and are reaching folks in faith, healthcare, financial, and other community settings, and have some really great lessons that they've learned and share with us and you. So I hope you now have a sense of what some of the key resources are on that resources page, on the community resources page. Let me show you a few more spots on our website that you don't want to miss. If you need to press pause, take a stretch break, now's a great time to do it. So we have one more tab that is chock full of examples to help you learn how best to approach this in your community, and a place to go to read stories from the heart. Our work is built on personal stories, told about experiences when it comes to conversations. And we've collected many different perspectives shared on this topic from various backgrounds, cultures, ages, etc. You can find them by clicking here on our blog tab. So I'm going to quickly dive in to the several types of blogs that we have. These are just a few sample blogs that share lessons on reaching, spreading, and sustaining these conversations across communities, from outreach tactics to supporting solo agers. We also put together resource compilations geared toward a specific topic or audience to make it easy to find all the related resources we have. Some examples here include resources for financial or other professional service organizations, resources to help reach Spanish-speaking audiences, and a compilation of resources to support caregivers of those living with Alzheimer's disease or other forms of dementia. Next up, we'd like to create what we call listicles, including 2 very popular lists of must-read books on death and end-of-life care. We have a list of things to watch together to jumpstart conversations, a list of podcasts and games, among others. In these, we always ask readers to share their favorites, and we get wonderful ideas and responses that you can read about. And as noted, if you're looking for personal stories that might appeal, we have an ongoing blog series of stories from a diverse group of wonderful human beings who open up their hearts and share what conversations have meant to them and those they care about. So, what's the best way to keep up on all of our latest? Keep an eye here on our homepage. At the bottom is a What's New section that has the latest resources or news highlighted. And you can also click on our What's New tab up top here for the most up-to-date additions to our resources. This includes new blogs, webinars, or upcoming events, and other tools. If you've already gone through all of our resources and just want to know the latest, simply check here weekly. All right, we're getting ready for the last 2 sections of our call, common questions and ways to engage. So at the beginning, I noted I'd go over some of the most common questions we get from community members. Some of these questions may be yours too, or perhaps, I hope, I've answered some of them across the last 20 minutes. The ones we get most frequently are found on our About Us tab. Click here and you'll see the questions and our answers to these questions. So many groups reach out to connect with us, which is one of my favorite parts of my job, as I learn so much when connecting with others. Here are the most common questions we receive. For example, I want to get involved, or I want to present or lead a workshop. How can I get started? How do I get copies of your materials? May our organization connect to your website? Or can I request someone from the Conversation Project to speak at my event or participate in a podcast or interview for my article? Again, the answers to each of these can be found under our About Us page. And most of those answers are yes, yes, and yes. And last but not least, I want to share several ways you can engage with our growing network of community champions. The first way is to participate in National Healthcare Decisions Day, or NHDD. The Conversation Project hosts NHDD on April 16th every year. You can learn more about NHDD, its origins and its founder, and ways to participate by going to the last tab on our homepage, circled here. Another place to go back to is our Get Involved tab. Go ahead and click here. Once you arrive on this page, scroll down past the 3 resource boxes that I already talked about, and you'll see these 4 ways to connect. First, our newsletter link. Sign up for our newsletter to keep informed on all the latest. Next, if you click on our Community Call Connection link, it takes you to this page where you can access all of our past call recordings and see when our next call is scheduled. These calls we have are broken into 4 categories. We have several calls on making the most of the Conversation Project resources and getting started. That's where this call can be found. I also highly recommend you listen to the Community Planning 101 recording, highlighted here in red, as this will give you a deeper dive into how you can get started in your community. This call walks you through our Getting Started guide for communities, as I noted before. We also have several recordings and slide decks focused on community planning. Check out all the various topics. There really is something for everyone. We have some special interest topic calls you can also listen to. The ones focused on NHDD have some great ideas for what you can do to join in on this annual event from communities all over the globe. And lastly, we have a couple trainings you can listen to. If you want to run or facilitate a workshop, I highly recommend our speaker training session, pictured there and also listed on the bottom in red. Also on our Get Involved page is our Conversation Champions map. If you scroll all the way to the end of that page, you'll see this map here. We invite anyone who is using our resources or sharing our messages to put their pin in the map so folks can find them and network. We want to encourage folks to network and learn together. So I encourage you to search in your area to see if anyone has their pin on the map, or search by category. Maybe you want to see what other faith groups are doing. Not everyone we've worked with or who is doing something in this space is listed on the map. This just scratches the surface. So if you don't see a pin in your area, it doesn't necessarily mean you're alone. Take a look and know you can always connect to us to see who else we may know about that you may connect with. Just ask us. The last place I'd suggest you explore to engage with others is our Facebook page for Community Champions. This is a private group page. It's for those who are leading conversations, workshops, programs, or other activities centered around care wishes through the end of life in your community. It's a space for idea sharing and connecting. Alrighty, so we're just about at the end of our time together. And I really hope this orientation to our resources gave you a solid place to start. I'm hoping it didn't overwhelm you, but instead helped you hone in on a couple places to go and resources to open up to get you started and to understand the importance of conversations across communities. So at the end of any session we lead, we share some leaving in action steps, and this recording is no different. So here's a checklist you can use to take action now that you've been oriented to all of the free things we offer. First, start with self. Reflect, talk, listen, and take action. Use our guides and have some conversations with those who matter in your life. Next, commit to learning and sharing what you are learning with us and our community. Participate in a call or listen to some of the recordings when you have time. Peruse our map, join our Facebook discussion group, and take our survey to share your journey with us. You will get access to this survey when you sign up for our newsletter, and you'll keep up to date on our latest through the community engagement newsletter. Lastly, follow us on social media. We are always putting out content that you can reshare to make it easy on yourself. All of our handles are listed here, and please share yours with us. So lastly, here is a compilation of all I've shared today and where to access it on a page. There is no one way to do this work, so we can't offer an exact roadmap for how to do this in your region, but I truly hope this helps you. You can go wherever interests you most, or click on whatever resource seems to make you tick. Thank you so much for taking this journey with me today. Our team is always here to connect, so please feel free to reach out and for us to answer anything that I missed. We are so excited you are part of our community. Thank you for your passion for conversations that matter. And a final thanks to our funders for supporting us and allowing us to share our resources freely to anyone in need. So that's a wrap. Goodbye for now.